Of the normal artery, there are three layers: intima, media and adventitia. This is a basic knowledge. Intima has a monolayer of endothelium, that is a basal lamina over which there is a layer of endothelial cell. So, some intima, vessels of some intima like, intima of some vessels like proximal left anterior descending or main left-sided coronary artery, it is more thicker, it is more cushiony than any other artery. So, there is a regional difference between the size of the intima. So, there is subendothelial connective tissue which is composed of collagen. Initially, in an embryo, this collagen is of type 4, that is which is loose non-fibrillary collagen. Later, as we become adults, it is replaced by type 1 and type 3, which becomes like fibrillary collagen. It becomes more complicated collagen, the subendothelial connective tissue. So, this collagen is very important because that is going to trap the LDL in the future atherosclerotic block. If it is non-fibrillary, it cannot trap. If it is fibrillary, it is going to trap the LDL. So, this intima thickens in the adult. This is called diffuse intimal hyperplasia, which might be normal, it may not be a disease state because of increase in the deposition of 1 and 3 fibrillary type of collagen. Media has one is it is in the intimal side it is limited by the internal elastic lamina, while on the adventitial side it is limited by the external elastic lamina. It has only two type of cells. One is the smooth muscle cells, which is very important. It deposits collagen and gelatin, that is the main function of the smooth muscle cell. And the other is the elastin, which is fenestrated. This elastin fiber is very regular and concentric in case of elastic artery. In the muscular artery, smooth muscle predominates over the elastin fiber. Adventitia, following the external elastic lamina, that is adventitia. Adventitia is a more loose tissue. It has only some foam cells, nerve endings, blood vessels, vasa vasorum, mast cells presenting antigen to the T lymphocyte from the circulation. So, how the atherosclerosis is initiated? This is a very important progression. Following an atherogenic diet, what happens? This is the endothelium of the intima. So, what happens is that the LDL in the circulation becomes small LDL particles, and these LDL particles can easily cross the intima and come to this is subintimal connective tissue. So, these LDL particles are trapped inside the peptidoglycans which are present in the subendothelial connective tissue. Once they are trapped, they undergo oxidation and glycation. This depends upon the presence of either free radicals in the form of superoxides or the absence of NADP or NADPH oxidase. Depends upon the oxidative state. If there are more free radicals, they become oxidized or glycated. Altered LDL is more toxic than the native LDL particle. So, they undergo oxidation or glycation. Following this, what happens? This oxidized LDL, they ask for expression of addition molecules on the surface of the endothelium. These addition molecules, either one of the four, they are called ICAM, this is intercellular addition molecule, VCAM, vascular cell addition molecule, or E-selectin, that is endothelial selectin, or P-selectin, which is platelet derived selectin. One of the four addition molecules are expressed like an antenna on the surface of the endothelial cell. So, this will ask for either of the macrophage monocyte or T lymphocyte from the peripheral circulation. So, they come in a saltatory movement, they come and settle on this addition molecule. Then there is expansion of chemokines or cytokines from these peptidoglycans, that is subendothelial connective tissue. This chemokine they are specific for monocyte or T lymphocyte. So, initially CCR2, that is C chemokine cytokine receptor 2, it calls for monocytes. With the monocyte have their surface ligand 2, CCL2. So, receptor with the ligand, they bind together. So, they call inside. While CXCR, chemokine receptor 9, 10, 11, they call for T lymphocyte. So, how these chemokines will act for the transcytosis or intercytosis, either between the endothelial cell or across the endothelial cell, they move and come inside this subendothelial connective tissue. Now, what happens? They have to go and eat this LDL particles. They prefer oxidized or glycated LDL over native LDL. So, what happens? There are surface LDL receptors in this monocyte, that is called scavenger receptor. This scavenger receptor will bind the LDL and they phagocytose, resulting in how many particles they phagocytose. That makes the size of the macrophage or a monocyte, whatever. Monocyte becomes a macrophage once it ingests the LDL. So it becomes a large, foamy, engorged macrocyte if there are more altered LDL. If there is only mild little bit of LDL, then it becomes a smaller foam cell. So these foam cells, they can cause progression of the atherosclerosis. So the progression of the atherosclerosis